Rhodoplast International was started to help children born with cleft lip and/or palate deformity in underdeveloped countries. Every year, almost 250,000 children are born with this deformity, and most are born in the poorest parts of the world, where resources are severely limited, scarce, or non-existent. The majority born in poorer countries receive very limited or no treatment at all. One of our goals is to help eliminate non-treated cleft lip and/or palate. Rhodoplast was born in Rotary with another goal of giving Rotarians an opportunity for hands-on international service. Our objectives are to provide long-term solutions to the problem of cleft lip and palate in children by funding and coordinating surgical missions in developing countries, training and mentoring local physicians, launching public education projects, and advancing research. We're developing specific programs addressing secondary problems such as alveolar bone grafting and maxillofacial surgery. Rhodoplast's international efforts go far beyond surgical intervention. We help foster international goodwill, peace, and understanding. To achieve our objectives, we rely on sustained support from our current donors and outreach to philanthropists everywhere concerned with the health and well-being of poor children in the developing world. Rhodoplast provides free reconstructive surgery for children and untreated adults born with cleft lip and/or palate. We recruit highly skilled and accomplished plastic surgeons, pediatricians, anesthesiologists, nurses, dentists, orthodontists, and speech pathologists as volunteers to provide a multidisciplinary cleft team in our host countries. Rhodoplast was one of the first organizations to emphasize a multidisciplinary approach to cleft care during international missions by adding dental, orthodontic, and speech services. A partnership with the University of the Pacific Dugoni School of Dentistry and Genetics Department allows us to fund research and provide genetic samples for further study of causes and prevention of the anomaly. We are effective because we partner with Rotary clubs in countries where surgical services for cleft lip and/or palate are most needed. Local Rotary clubs serve as an introduction to host hospitals and the local medical communities. This is followed by a site visit to the Rotary Club and Mission Hospital to make sure the facilities allow for safe and effective surgery. Rhodoplast International is a small organization. Overhead costs are low. Our streamlined fundraising efforts and tight operating costs mean that 78% of every dollar donated is directly applied to patient care. Through 2013, we've accomplished 185 missions and operated on more than 16,000 children in 24 different countries. Statistics and records are kept for each mission, including computerized medical records on every patient. For every mission, we document the cost of donated materials and services. We have significantly reduced the number of primary cleft lip and palate cases in many of our sites. As a model for future development, we're expanding the services that we provide. We're initiating more advanced programs for alveolar bone grafting, maxillofacial surgery, and major burns. One of the most commonly misinterpreted aspects of our organization is that, due to advertising, we're confused with other organizations that do similar work. People often tell us they've donated to our organization, but find that they confuse us with another. We're constantly explaining the unique medical, non-medical makeup of our all-volunteer teams. Additionally, many people think Rotoplas is well-funded through Rotary International, which isn't true. Actually, we're funded by Rotary clubs, Rotary districts, private individuals, and private foundations. When we sent our first mission in 1993, it was not done with the intent of establishing an organization. The enthusiasm and life-changing experiences of the Rotary non-medical volunteers led to greater interest, more invitations, and a self-sustaining organization. Rotoplas has survived and was successful even during the economic downturn of 2008. We've operated on more than 16,000 patients in 24 different countries. We're a well-respected organization in the medical community in the United States and around the world, and are very proud of our 4-star Charity Navigator rating. For each mission, our organization transports roughly 28 medical and non-medical volunteers and 34 boxes of supplies and equipment all over the world. We're constantly challenged by political unrest, which makes travel difficult. We're vulnerable to the difficulties that arise during customs with all our supplies. It's challenging to obtain the necessary visas for all of our volunteers. We also have no control over weather conditions. There are many missions that have been interrupted due to natural disasters. We need to purchase new surgical instruments and durable medical equipment. Shipping equipment by air to foreign countries takes its toll, and equipment has to be replaced or repaired continually. If we increase our durable medical equipment and surgical instrumentation, we could increase our missions per year by sending 2 missions at a time. Additionally, Rotoplas would like to send smaller, more specific teams to certain sites. Specialized missions require more extensive resources due to the advanced nature of the medical procedures and teams needed. Additional equipment means more help to more children. We would like to create a Rotoplas Fellowship program for surgeons in the developing world who are interested in caring for patients with cleft lip and palate. We hope to sponsor seminars for education about the treatment of clefts in every site where our teams work. Rotoplas is establishing permanent facilities at selected sites where patients can receive free multidisciplinary treatment for cleft lip and palate deformity, including dental, orthodontic, hearing and speech therapy, and psychological support. We would like to see a reduction in the incidence of clefts by offering increased genetic counseling, dietary education, and supplementation using our genetics program.